Hey, welcome back to Mind Pump TV. You're about to see a clip of Dr. Rand answering questions revolving around hormones and testosterone and health. If you want to see if you're a candidate for this, whether you're male or female, head over to mphormones.com, fill out their questionnaire, see if hormone therapy is right for you. All right, enjoy this video.
Hi, I'm Dr. McClain, and I'm a doctor of regenerative and sports medicine. I've been asked to speak about the safety of long-term testosterone replacement therapy. It's kind of a tough question to answer because long-term can be defined very different ways. How many generations, how many lifetimes do you have to go through to consider it long-term? I would argue that certainly long-term testosterone appears to be better for you than not because we've associated a deficiency in testosterone levels, whether produced endogenously or received exogenously, with things like coronary artery disease, type 2 diabetes, colon cancer, prostate cancer, and osteoporosis. So we know there's at least a correlation between low testosterone and those disease processes, and of course quality of life. So to date, we have no evidence that long-term therapy is in any way detrimental. In fact, to the contrary, the only evidence we have is that replacing testosterone, keeping levels of testosterone at a higher level is only beneficial.
Hey, I hope you enjoyed that video. If you want to see if you're a candidate, don't forget you can head over to mphormones.com, answer some questions, and see if hormone replacement therapy is right for you.